Good morning, everyone. I am Megan Rogers with Indiana SHIP. I am the volunteer supervisor for SHIP in the Northwest region of Indiana. And I am joined this lovely Wednesday morning in May by Susan Spilly, who is our special populations coordinator. I believe sometimes I get confused with titles. She's nodding her head and smiling. In Indy, but she covers the whole state. So she is on the road quite a bit. Good morning, Susan.
Good morning, Megan. It's good to see you. It's been raining cats and dogs here. I don't know about where you are.
It was raining yesterday. It hasn't rained yet, but I believe they're calling for rain. So we'll see. Yes. So again, good morning, everyone. We are here to talk this morning about Medicare and answer your burning Medicare questions with Ask the Expert. And this morning, Susan and I are your experts in Medicare. So please go ahead and chat in your questions in the chat box, and we will answer those this morning. And we're watching the chat box, both of those, to see your questions. So go ahead and get those in there throughout the presentation. But while we're waiting for your question, Susan, I'm going to throw one to you. So we have had a few changes to Medicare this year, some good changes. So would you like to share one of your favorite changes with us?
Well, they're all my favorites because I think they're all improvements.
Yes.
But I think what I love the most is the brand new rule that was effective January 1st, that people on Medicare who are under 65 years old are able to purchase a supplement plan with no medical underwriting. And the medical underwriting means they can't look at your medical issues. And if you think about people who are receiving Medicare benefits and who are under 65, those are folks who've been on Social Security disability for a couple of years. And if you're on Social Security disability, the high chance that you have medical issues is certainly there. So these are folks who really didn't have a lot of choices other than original Medicare or Advantage plans. So for them to be able to get a supplement plan without having their medical issues considered is terrific. So specifically, there are lots of Medigap plans available, and they're named by letters of the alphabet, A through N, minus a few that have dropped off over the years. And folks can buy plan A, B, or D at the same monthly premium that someone who is 65 can purchase it for. And the other ones, those companies cannot charge more than double the premium that a person at age 65 would pay. So double sounds pretty high, but really, if you're looking at $100 or $125 monthly premium, that would be $250. And if that would be, the benefits to those would be terrific and quite possibly lower total out-of-pocket costs for medical care and give you a complete wide range of providers, because we know Medigap plans are accepted nationwide by all Medicare providers. So this has been a terrific thing for young people on Medicare. And I think if I had to pick, that would be my favorite change. Which one is yours, Megan?
Thank you, Susan, for that information. That is a good one. However, my favorite, if I have to pick, is the 2000 max out-of-pocket change for our medication for Medicare beneficiaries. Prior to this year, that max out-of-pocket was probably closer to about 4,000, 5,000, and now it's down to 2,000. So that is the most you are going to pay as a Medicare beneficiary with your Part D, either a standalone Part D or your Part D in an Advantage plan. Now, if you don't have expensive medicine, you're not going to pay that much, of course, but if you are on brand name medicine, expensive medicine, or a lot of medicine, my dad is on 27 different prescriptions. So, you know, a lot of us are on a lot of medicine, or a lot of Medicare individuals are. So it can add up quickly. And I have seen many clients who reach that max out of pocket in a month, 2 months, 3 months. So this is going to save people a lot of money.
Well,
So
that's
that
a
is
good one
mine.
too. And I'm glad that came to us through the Inflation Reduction Act. So that's a national thing. Whereas the
Mhm.
Medigap policies, those go state to state. So it
Good
was our
point.
state legislature that did that and our state's Department of Insurance. And I will say we do have a question that's chatted in on our Facebook page. So let's go ahead and answer Sean's question. If I'm a veteran, do I need to enroll in Medicare? What do you say,
Mm,
Megan?
that's a good one. Well, my answer is it depends. Every veteran is going to be different on this. Um, and Susan, help me with this if I'm a little bit off with the answer, but veterans can be labeled at a certain percentage of disability. And depending on that percentage, that might determine how much health care you get through the VA, or how long you might get that health care based on the veterans I've seen and talked to. And it also depending on who you're getting your medical care through. If you're going to the VA or a VA approved medical facility or doctor, then and you are approved for VA health benefits, you'll have that covered. But if you're going to a doctor or a medical facility that is not approved through the VA for your health care, then you need other insurance for that. Medicare is only going to cover you at a non-approved VA facility or doctor, and the VA will only cover you for health benefits at a VA facility or doctor. So you may have to have both to make sure that you're getting all your medical care covered. But if you are confident as you can be, that you are going to be covered long term by the VA and at 100% and at all your doctors, then you could just go with the VA. However, if you're not, then you probably do need to add on Medicare when the time comes. It's important to note that the medical care of the VA health insurance or health benefits is not creditable. And creditable means as good as or better than Medicare. So if you decide not to take your Medicare when you're first eligible and you stick with the VA, but then later on you need Medicare, you would have a penalty, which means you have to pay a higher premium, at least for Part B. If you have premium free Part A, you don't have to worry about that. There's no penalty. And then the medication, the drug piece of the VA is actually creditable. So you could delay that. And if you need that later on, you wouldn't have a penalty. Susan, do you have anything to add to that?
That's a great explanation. And I'll just point out two things that care that veterans can receive at a VA facility is always dependent on that federal veterans VA budget. And I've been
Good
around
point.
for a few years, and so I've seen various categories of veterans receive or be able to get certain types of care at the VA, and I have seen them slim that down. It's just important to remember that care at the VA is care at the VA. Medicare is insurance. And it's not insurance that you have at the VA. It's just a place where you can get your care. And I think to some extent, the easy access of the VA, or maybe not as easy, comes into some people's decision-making process. Just take my dad, for example. And happy birthday, Dad. He's 94 today.
Happy birthday, Susan's dad.
He's not on Facebook, so he'll never know but um he um he was on a very expensive medicine for a
Mhm,
while. He did consider getting it from the VA because he's a, veteran of foreign wars.
mhm,
And but he just didn't really want to hassle with coming to Indianapolis and
mhm,
being a VA doctor and all that stuff. So he just stuck with his Medicare plus his additional insurance. So it's nice to have a choice, but just remember, VA care is not insurance.
mhm,
Medicare is insurance.
mhm,
And there are some rules around if a VA facility is not available for you or a service is not available for you. There are there's a teeny tiny bit of wiggle room about where you can get your care. But
mhm.
generally speaking, VA care is provided by a VA facility.
Correct.
So,
Well, thank you, Susan, for adding that on. We do have another question chatted in the chat box. Good morning, Janine, and thank you for your question. So, Susan, I'm going to shoot this one over to you. Does Medicare cover hearing tests and hearing aids?
well, Medicare itself, Medicare A, which is the hospital or skilled care, Medicare Part B, which is the outpatient medical care, actually does not cover a hearing test and hearing aids. So when I talk to folks who are thinking about getting their Medicare and maybe they're still working and they're on their employer group plan, if they have that benefit, I always tell people, get a hearing aid before you leave your employer group plan. Because original Medicare to date does not cover that. Now, there's a managed care way to get your Medicare benefits, and that's through the private insurance company who offers Medicare Advantage plans. And even though the government pays those Advantage plans to provide your care, so you would think that people could get the same Medicare services. That's not quite true with Advantage plans. There's a lot of differences, but one of the things that most Advantage plans do offer are hearing tests and hearing aids. So that could be a consideration when you're making your decision about which way you want to go, if you want additional insurance to original Medicare Parts A and B.
Great answer, Susan. Thank you.
Sure. And I see another question. Julia, thank you for joining us, Julia. She asks, does your GAP, she means Medigap or Medicare supplement plans, cover the Part B deductible? What do you think about that? Julia probably doesn't know she's asking a trick question, but explain it to us.
All right. So that is a trick question, but I believe I have the answer. It depends on what plan you pick. So, as Susan said earlier, we have multiple plans from A to N. Now, there are two plans, C and F. Now, they do cover the Part B deductible. However, not everyone can get C or F. If your Medicare started, your A or B started before January 1st, 2020, you can keep a C or F or you can get a C or F, and they do cover the Part B deductible. Now, all the other plans that are available do not cover the deductible for Part B. And Plan G or Plan N probably are the most picked plans, at least for the clients I see. And again, they don't cover the Part B deductible. However, for G, it covers everything else, the Part A deductible, the Part A and B copays, the nursing home copays, excess charges, all that. There are with Plan N, there are some additional copays with that, but it is comparable to G outside of that, except it doesn't cover the excess charges. And the Part B deductible this year is it 257 or 259, Susan?
257.
Perfect. Perfect. Yep. I see another question in the chat box from Sean. Thank you, Sean. What is the biggest mistake people can make in Medicare or with Medicare? Well, Susan, what do you say?
Well, when you say making a mistake, that kind of assigns a value judgment to that. And the one thing you can count on if you seek information from Indiana SHIP and a SHIP counselor is that we try to keep out our own biases and value judgments. But I think I could just probably say people not getting information from a credible source to make their own decisions about what's best for them is probably the most regrettable
Mhm.
thing that happens in their Medicare lives. And
I
that's
would
why
agree.
we at Indiana SHIP do these Facebook Live programs. We are doing live in-person presentations all over the state. We have all kinds of printed information. We have all of our Facebook Live videos on different topics posted on our page and our YouTube channel. And we are available to come to your organization and talk about Medicare. Any facet of Medicare you'd like us to discuss, we are happy to do that. And Megan said, I cover the whole state, and I do, and I can come to you no matter where you are. But like Megan in Northwest Indiana, we do have other coworkers who cover certain sections of the state. So there are plenty of people who are available to you if you would like us to come and talk to your group about Medicare.
Mhm.
And then, of course, we have local counseling sites, and we have about 100 of those that cover the state. And to find out where we will be presenting, where your local site is, of course, just visit our website or give us a call at the office.
Thank you, Susan. And I would agree with that answer. When I get a call and someone says, well, I spoke to my neighbor Fred or my coworker Sally, I always cringe because I can't wait to see what Fred or Sally told them about Medicare. Sometimes it's correct, sometimes it's not.
Right.
Yeah.
And you know what I cringe at is hearing people say, I don't know how I got signed up for this plan.
Uh-huh.
Somebody came to my house
Yep.
and he was such a nice young man. I let him in and he had me
Mhm.
sign papers and said I would
Mhm.
get a gift card for groceries. And, you know,
Mhm.
those are certainly heartbreaking situations because in some
Yep.
instances you can't unring those bells.
Exactly. Yeah.
So Sean did comment that she just talked with a client yesterday, and that was precisely what her regret was.
Mhm.
Not getting all the information from a credible, and I'll throw in impartial source of Medicare
Mhm.
information.
Exactly.
Yeah.
I teach a Medicare class up in South Bend every week for 10 weeks. And we met on Monday, and one of the students is getting on Medicare soon. I believe it's September or October, maybe August, one of those months. And she shared with us that she had two younger ladies come to her door and they introduced themselves and said, well, we would like to partner with you on your Medicare journey. And of course, we already had covered insurance agents, partial sources, impartial sources. And she was like, well, thank you for coming, but I've already got my partner in my Medicare journey, which is me. So, but yep, they do come to your door and you do want to be mindful of that.
Right. And you know, that is very much so against the Medicare
Mhm.
marketing rules.
Mhm.
The federal government in the state of Indiana does have lots of rules about how you can be approached or sold
Mhm.
um, Medicare products.
Yep.
So if that happens to you, then get their card and you can call the Indiana Department of Insurance and file a complaint. You can also file a complaint with Medicare itself at 1-800-Medicare.
Mhm.
So
Exactly.
that's against the rules and they shouldn't be doing that.
Exactly. And
Yeah,
that's what I told her.
right. Good. Okay, Janine has another question. She wants to know, how does she find out about her maximum out-of-pocket costs?
Ooh, good question. So, assuming Janine has one of those managed care Medicare plans, an Advantage plan, she can look in her explanation of benefits packet that was received when she joined the plan, or at the end of the previous year or the beginning of the new year. They send those out annually, and it should be listed in that packet. You can also go onto the website and find the plan that you're on, or if you have an account for that plan, it should be in there if you log into your account. You can also call the plan. Or another way that I help clients find out what their max out of pocket is, we may go on to Medicare.gov and look at the plan in there. We pull up that specific plan and we can see all the details, the max out of pocket, premiums, deductibles, and the copays for the medical services. Assuming, or in case you have a supplement, a Medigap, you wouldn't have any kind of max out of pocket. It would all be covered. But unlike what we talked about earlier, you may still have to pay your Part B deductible.
Right. And there could be some other, depending on the supplement plan you get, there could be other charges there.
True. Very good point. Thank you.
We have a really nifty chart that shows all the supplement plans that are available here in Indiana, what they're called by letter of the alphabet, and all of the things that they cover. So we also have two high deductible plans. And so you would know how much you would have to fork out before the structure of that plan kicked in. So Janine, if you have further questions about that and you want to share specifically what you have, just call us at SHIP and we're happy to make sure you understand what plan you have, how it works, and specific questions. So Deborah has asked a question that Deborah's prone to skin cancer. What do I need to be asking or looking for to cover my dermatologist? Well, this is a very timely thing, you know, skin cancer, since we're approaching summer and most of us will be outside getting our vitamin D, but some of us may not doing that in a very safe way. So, and I just had a skin cancer screening free at my local hospital. Deborah, if you're in Indianapolis, or in Kokomo, I'm happy to share that if you want to private message me where I got my free skin cancer check. But again, you know, it kind of depends on what kind of way you went with your Medicare. Do you have Medicare and a supplement plan, or do you have an Advantage plan? Some Advantage plans do have rules around getting referrals for specialists. I think the first step with an Advantage plan is usually see your primary care physician, and he or she can check your spots and see if you need further evaluation on those, and then they can refer you to a dermatologist. But remember, if you do have an Advantage plan, the best bang for your buck is to stick within their network. And to find out who your providers are in your area, you can call your plan. You can look on the plan's website. You can also look, there's a link to the plan's website on Medicare.gov. And just make sure you're looking for your exact plan, because there's a lot of Advantage plans sold by the same company and they have one word different in their name. So it could be XYZ's blue gold plan, or it could be XYZ's blue pink plan. And they're completely different plans with completely different benefits. So just make sure you know what you're asking for. I tend to use the code number that they have on your plan information. That way, you know exactly. They know exactly what plan you have.
Mhm.
It's really not good enough to call a company and say, "Do you take XYZ insurance?" That's not specific enough.
Mhm.
Um, so I know it's hard to get into specialists these days. So if you're thinking you have a problem spot, try to get in, try to make an appointment early. And if you're an Advantage plan, stick to your network for maximum coverage or benefit. If you're on a Medigap plan, then it would just be anybody who takes Medicare. So when you call the dermatologist that you want to see, just make sure they're a Medicare provider, and I'm pretty sure they will be.
Ooh, we got another question from Janine. I love this question because it's one that we get frequently. Why am I getting insurance calls after open enrollment? Annoying. I agree, Janine.
Yes, that's the second most asked question when we're out at events at
Mm-hmm.
health fairs and community
Mm-hmm.
fairs.
Mm-hmm.
First one is always, do I have to sign up when I'm 65? The
Mm-hmm.
second one is, how do I get all this phone calls, emails, texts, and U.S. Postal Service mail to
Yep.
stop? That's
Mm-hmm.
funny. But go
Mm-hmm.
ahead. What do you think, Megan?
Unfortunately, it's going to be hard to get those stopped. Now, I believe you can sign up on the no call list for those, but honestly, they still come. Susan, do you got a better answer?
Well, what I tell people is that they shouldn't answer their phone.
Well,
Sad to
true,
say.
yeah.
If you don't have that call, that number in your address book, then you just don't pick up.
Mm-hmm.
And if it's a sales call, then they probably won't leave a message.
Mm-hmm.
But every time you answer your phone, your name and phone number and probably all other kinds of data about
Mm-hmm.
you gets put on a list. This is a very simplistic explanation. And that list is sold for even more money because now companies buy a list that have somebody's information and that they answer their phone. I also hear from people that they just keep those telephone solicitors or salespeople on the phone a long time just to mess with them.
Mm-hmm.
Um, but that results in your name being put on a list for not only someone who has an accurate number, it's someone who answers their phone and
Mm-hmm.
it's someone who engages with the caller. So as long as you pick up your phone, there is a chance that they could say something to convince you to buy something. And this goes with everything, really, not just
Mm-hmm.
Medicare insurance products. So the key is um, don't answer your phone.
Mm-hmm.
You can block those calls. And I have heard very recently from a trusted source from our friends at Senior Medicare Patrol that blocking a number does not put you on that higher sold
Oh, good.
list. There was some discussion, but they verified that. So I know you're blocking a lot of numbers because you get a lot of phone calls,
Mm-hmm.
but they should slow down. But they'll rev up, and so will your mail
Mm-hmm.
um, more towards open enrollment. Because during open enrollment at the end of the year, people can buy a new Advantage plan, people can buy a new prescription drug plan. We see a lot of commercials on TV.
Mm-hmm.
So don't call the numbers on TV. Don't answer
Please
your
don't.
phone.
Mm-hmm.
Don't put your name in a hat to win a door prize at a health fair. Um, or if you do, make sure that door prize is worth
Mm-hmm.
soliciting calls because then you've just given them permission to call you.
Yeah, exactly. For a while, my dad, who does have dementia, in his nursing home room had a phone, and he'd pick it up sometimes. Sometimes it's hit or miss. If he picked it up, sometimes he just let it ring. But he kept getting a lot of Medicare calls, and I talked to him about don't pick up. Well, sometimes I'm bored and I like to mess with them. Well, I get that, but don't pick up. And then sometimes he'd be on the phone with them when I would walk in the room and he'd hand the phone over to me and they'd be like, well, we're calling to discuss his Medicare benefits and to make sure he has everything he can possibly have. And I would fudge the truth a little bit and I'd be, well, I'm his daughter and I work for Medicare. Click. They didn't want to talk to me.
For sure. Yeah.
Yep. Well,
So,
now he doesn't have a phone in his room, so we don't have to worry about it. So,
yeah.
yep.
So we did have another question from Terry. She wants to know, do you have to be 65 to sign up for Medicare?
Ooh,
This is kind of another little trick question, Megan. What
it
say you?
is. Let's see. So the answer is no. So there are three ways you can get Medicare. The most common is being 65 or older. Then we have, if you have Social Security disability, any age, you are able to get Medicare once you've been on Medicare for 24 months. And then the 25th month, your Medicare starts. And then the third reason is end stage renal disease. So if you're diagnosed with ESRD, end stage renal disease, you get Medicare, or you can choose to get Medicare. Yep.
Right.
So
At
those are the
any
three main
age.
reasons.
Even children. We had a couple months ago, some of our coworkers were speaking to a mom of a 9-year-old little girl who had end-stage renal disease and she was getting Medicare. So,
Wow.
yeah. Okay, another question from Terry. What happens when you miss your 7-month window to sign up for Medicare? Let's assume that this is a person who's age 65 and newly eligible. Tell us about the 7-month window and what happens if you miss that, Megan.
All right. So 7-month window. So you're new to Medicare. You get, let's say it's because you're turning 65. So we've got your birth month. So the 3 months before your birth month, and the 3 months after is when you can sign up for your Medicare. So that's the 7-month initial enrollment period for you. If you sign up in the 3 months before your birth month, your Medicare will start the first of your birth month. If you sign up the month of your birth or the 3 months after, your Medicare will start the first of the following month that you signed up. So let's say your birth month is June, and you signed up in June, your Medicare will start July 1st. And it's the same pattern if you sign up any of the 3 months after your birth month. So that's your initial enrollment period. So if you do not sign up in that 7 months, I'm going to give you two answers. The first answer is that you do not have creditable employer insurance. Okay, let's say you don't have any insurance, but you don't sign up. So you will not be able to sign up for Medicare until the general enrollment period. So let's say your birthday is in June and you don't sign up. So you cannot sign up now until the general enrollment period, which is always January 1st to March 31st. So that would be your next available time that you can get Medicare, and you would be subject to penalties. So let's say you don't sign up for 2 years. So you wait a few years. Maybe you didn't know this was a thing and you would get a penalty. So you're going to get, for your Part B, a 10% penalty for every 12 months that you do not have Medicare from when you were first eligible. So that would be a 20% penalty in this example, and it's based off the current premium. The current premium is $185. So you would pay $185 plus what is ever 20% of 185, like $36. So 36 on top of 185 every month for the rest of your life. And every year, usually the Part B premium goes up, so that penalty will increase as well. Now, there's going to be some loopholes. You know, if you qualify for Medicaid, the penalty will go away. If we can get you on Medicaid before the next general enrollment period, you would have a special enrollment to get Medicare. So there's some nuances. That's where these Ask the Experts are general answers. That's why you would want to meet with a SHIP counselor, because we can then discuss it one-on-one with your personal situation on what the answer would be for you. So that's my first answer. You didn't have employer insurance, you got a penalty. Now, what happens if you do have employer insurance? So you turn 65, you have employer insurance either through your employer or spouse's employer. And as long as it's creditable, as good as or better than Medicare, and if the employer has 20 or more employees, if you're getting Medicare because of being 65 or older, or 100 or more employees if you are getting Medicare because of disability, and you like the insurance, it covers what it needs to, it's affordable for you, in your opinion, then you can delay your Medicare penalty-free for as long as you have creditable employer insurance. So that is my very long answer.
I always tell people they have to meet 3 criteria: actively working or a large employer with health coverage and credible drug coverage. Yep. Okay, so Janine has one last question, and I think we'll just take this one last question and we'll wrap it up for today.
Perfect.
If you want to ask other questions, just text them in, and we keep up with our Facebook page, and it will answer those questions after the show. Her last question: how do I qualify for extra benefits as seen on TV?
Oh,
We get this question a lot.
You don't. You don't. That's my short answer. As Susan said, you shouldn't call the people on the TV. If you want to find out about extra benefits that you can qualify for, either, you know, the food cards, the utility cards, the vision, the dental, and hearing, it's always good to get an impartial source, so a SHIP counselor can sit down with you and talk to you about those. Those are generally with Advantage plans, and we can go over all of the components of the Advantage plan, those extra benefits, plus the health care piece. I always tell people in presentations that I give, don't pick an insurance company based on those extra benefits. Pick it for the health insurance. Does it cover your doctors? Does it cover the medication that you're on? Is it affordable for you? And then once you pick that plan based on those things, then you can enjoy the extra benefits that are in the plans. Susan, what do you have to add to that? I know I missed something, I'm sure.
No, that's exactly how I would have explained it. You know, advertising is advertising, and the whole point is to get us to interact with the advertiser. And that's by calling them or visiting a website, something like that. So just understand that what you hear on TV is, you know, it's kind of like those super duper coupons that they offer at the grocery store. They want to get you into the grocery store with offering you cheap prices on apples, say, knowing that when can you just go in the grocery store and buy one thing? You're going to be shopping around and buying other things. So it's a come on. It's for you to call them and interact with them. And then at that point, then they can promote their services and maybe sell you a plan. So just if it sounds too good to be true, it probably is. And if you want some impartial information on your choices, SHIP is where you can get that.
Mhm. Mhm.
Megan,
Exactly.
what do we have coming up next month?
Well, we have a few things confirmed and a few things not confirmed. But at the moment, we will have a Facebook Live on Alzheimer's and dementia, and we'll have a guest speaker for that one.
On June 2nd.
Yep, on June 2nd. On June the 11th, What to Know Wednesday, Susan is leaving me to fly solo. So we'll see what trouble I get up to. But the plan for that day is to have a coffee and conversations with one of my SHIP sites. So I will be working on that. And then we will also be here on the 16th and 30th, I believe, and we are still working on confirming those topics, but we may have some guest speakers as well for those 2 dates. And once we get that all confirmed, I will get the calendar put together and get it up on Facebook in the next couple weeks. So be looking for that. We will have a full lineup. And this is the last Facebook Live for May, because the next Monday that we would have a live is Memorial Day. So we will be taking that off for that holiday. But back to see you in June.
Thank you all for joining us. Thank you for your terrific questions. We really appreciate it. And again, if you have other questions, just write them in and we will get back with you as soon as we get the notice that you put something in. We're pretty quick responders.
We are. Bye, everyone.
Have a great day.